Hi, I'm Renée Leahy, and I'm a physiotherapist with the Psychosocial Oncology program at the Ottawa Hospital Cancer Program. This video was developed to provide you with general guidelines and information on exercise to help you recover from your breast surgery. Remember, everyone is different. Follow the suggestions that feel right for you. If you have recently been diagnosed with cancer, it is important to take special care of yourself. Studies show that one of the best ways to do this is by staying physically active. It is wise to include some regular form of exercise to your daily life, even during cancer therapy. Moderate aerobic exercise, such as riding a bicycle or taking a daily walk, as well as the use of light weights for strength training, can enhance your physical well-being and encourage your recovery. A question I often get from patients is, how much exercise do I have to do? We often suggest 150 minutes of moderate exercise per week, such as a brisk walk, or 75 minutes of more vigorous exercise per week. If you are already there, fantastic, keep up the great work. These guidelines will apply at all times, with exception of the 4 to 6 weeks following your breast surgery, which I will go into in detail later. In this video, we will be going through the arm exercises that will be important following your breast surgery. The goals of doing these exercises are to minimize any pain and stiffness that may happen after surgery, to assist in return of your full range of motion, to regain your strength, to improve your overall sense of well-being, and to give you a greater sense of control. You can be an active participant in your own recovery. These exercises are something that you can do to make yourself better. These exercises are also important if radiation is part of your treatment plan. The radiation team may ask you to raise your arm in a position like this, as this is the best position for treatment. In the first 4 to 6 weeks following your breast surgery, you should use your affected arm as normally as possible. It's allowed to be uncomfortable, but not painful. You can use your arm for light activities, such as brushing your hair or brushing your teeth. Be sure to pace yourself and balance periods of activity with periods of rest. You can walk, making sure that you're allowing your arms to swing freely by their sides, and also maintain a good posture. Some things to avoid during the 4 to 6 week period after your surgery. You should not get out of bed using the arm on the side of your surgery. You should avoid sudden movements until your drain is removed and the incision is healed. Do not lift greater than 2.5 pounds for 2 weeks after your surgery, and do not lift more than 10 pounds until 6 weeks after your surgery. Do not drive if you have limited movement of your arm, or if you have a drain, or if you are taking pain medication with narcotics. If you have any questions about these guidelines, please contact a member of your healthcare team. I will be reviewing 2 phases of exercises. The first set are to be done right after surgery. The second set is to be done once your drain is removed or after 5 days. These exercises can be found in a booklet that will be given to you by your healthcare team. Anna will help me show you the exercises to be done right after surgery. The first exercise is called Pump It Up. This exercise helps reduce swelling after surgery by using your muscles as a pump to improve your circulation in your affected arm. This exercise can be done sitting or lying down. Slowly open and close your hand. Repeat 15 to 25 times, approximately 3 times per day. Then slowly bend and straighten your elbow. Repeat 15 to 25 times, 3 times per day. The next exercise is shoulder shrugs and shoulder circles. This exercise can be done sitting or standing. Lift both shoulders up towards your ears. Hold for 5 to 10 seconds, then slowly drop them down. Repeat 5 to 10 times. Gently rotate both shoulders forward and then slowly backwards. Repeat 5 to 10 times in each direction, approximately 3 times per day. The next exercise is arm lifts. This exercise can be done sitting or standing. Clasp your hands together and slowly lift your arms upward until a gentle stretch is felt. Hold for 1 to 2 seconds, then slowly return to your start position. Repeat 5 to 10 times, approximately 3 times per day. The next exercise is shoulder blade squeeze. This exercise helps improve movement in your shoulder blade region and helps your posture. Gently squeeze your shoulder blades together, keep your shoulders level, and take care not to lift up or shrug your shoulders. Hold for 5 to 10 seconds, relax, and return to your start position. Repeat 5 to 10 times. This can be done approximately 3 times per day. The next set of exercises are called the first stage of healing. These exercises can begin once your drain is removed or after 5 days if you do not have a drain. The next exercise is called the wand exercise. This exercise helps improve the forward movement of your shoulder. You will need a wand to do this exercise. You can use a broom handle, a stick, or a cane. You should not feel any pain or pinching during these exercises. If you do, stop the movement before the point of pain or pinching. To start, lie on your back with your knees bent. Hold the cane with both hands. Your palms should be facing down, and your hands shoulder width apart and your elbows straight. Lift the wand over your head as far as you can go until you feel a gentle stretch. Your unaffected arm will help lift the wand. Hold for 1 or 2 seconds, then lower your arms. Repeat 5 to 10 times, approximately 3 times per day. The next exercise is called winging it. This exercise helps improve movement in the front of your chest and shoulder joint. To begin, lie on your back with your knees bent. Bring your hands behind your neck with your elbows pointing upward. If you are unable to comfortably place your hands behind your neck, place your fingers on your forehead with your palms facing up. Move your elbows apart and down to the bed. Hold for 1 to 2 seconds. Repeat 5 to 10 times, approximately 3 times per day. The next exercise is to help your posture. This exercise helps to improve movement in your shoulder and your posture. You may find it easier to check your movements by standing in front of a mirror. Gently squeeze your shoulder blades together and then rotate your thumbs so that your palms face forward. Hold for 5 to 10 seconds, relax, and return to the start position. Repeat 5 to 10 times, approximately 3 times per day. The next exercise is wall climbing. This exercise helps increase movement in your shoulder joint. Try to reach a little higher up the wall each day. Stand facing the wall as close as is comfortable. Place both your hands on the wall at shoulder level. Use your hands to slide up the wall as high as you can go until you feel a stretch. Hold for 5 seconds. Slowly return to the start position. Repeat 5 to 10 times, approximately 3 times per day. The next exercise is called snow angels. This exercise can be done sitting or lying down on the floor or bed. First, extend your arms out at your sides. Move them up to your head and down to your thighs, as though you're making a snow angel. Repeat 5 to 10 times, approximately 3 times per day. Once you are getting good movement in your shoulder, try this more advanced stretch. This exercise is called side bends. It helps to improve movement on both sides of your body. Sitting with your hands clasped together in your lap, slowly lift your arms up overhead. When your arms are above your head, bend at your waist and move your body to the right. Hold 1 to 2 seconds. Return to the center, then bend to the left, holding for 1 to 2 seconds. Repeat 5 to 10 times, approximately 3 times per day. When doing the exercises, you should see an increase in your pain-free movement and a gradual decrease in the feeling of stretch under your arm and across your chest. Keep doing these exercises until you have returned to what you could do before surgery. On average, this may take up to 2 or 3 months. If your shoulder movement is not improving within the first 3 to 4 weeks after surgery, let your healthcare team know. You may need a referral to a physiotherapist. Many patients I work with ask about lymphedema following breast surgery. Lymphedema is a buildup of lymph fluid, either in the arm or the chest wall on the side that you have had surgery. This can occur when lymph nodes have been removed or damaged, and there is more fluid than your lymph system can handle. Sometimes this excess fluid is slow to leave the tissues, leading to a swelling of the arm or your chest wall. Some early signs and symptoms of lymphedema may include tightness of the skin, shirt sleeves becoming tight, swelling in the arm or chest wall, decreased movement or decreased flexibility. Some people describe a tingling sensation in their arm or a feeling of heaviness in the limb. Do not fear lymphedema. It is not painful, it is not life-threatening, and it can be controlled with self-management. Early recognition and treatment of lymphedema provides the best outcomes. We hope that you found this information helpful. Just a reminder, talk to your healthcare team if you have any questions or concerns.